A clear distinction is often made between the mind and body based on the premise that they both are fundamentally different in nature. But when considering the mental health and physical health, don't you think that they both are interconnected? Mental health is a sensitive topic as there exists a lot of stigma and discrimination around it. Mental illness is assumed to be like an unwanted thought for some time, which will go away on its own. Emotional pain is not as visible as the physical pain. A cut on a finger will receive more attention than the sudden prolonged silence of a person. But do you know that poor mental health leads to an increased risk of developing physical health problems? And similarly, poor physical health can negatively impact a person's mental health, leading to an increased risk of poor health conditions. Stigma and discrimination can also worsen someone's mental health problems and delay or hinder reaching for help and treatment. According to WHO, 1 in 20 Indians suffer from depression. It has also been found that depression is associated with an increased risk of coronary heart disease. Healthy Minds World brings to you a Sunday webinar series, a series of 5 weeks on decoding mental health disorders to eradicate the stigma and myths on various mental health disorders like depression, suicide, anxiety, bipolar, and many more. Every Sunday at 11 a.m. IST, we will understand one mental health disorder from some of the leading psychologists in country.
Good morning, everyone. I am Pariti, the representative from the team Healthy Minds World. Hope you're all doing well. And in case you're not, I genuinely hope you have people around you who you can speak with, you can chat with, have light conversations with, and basically lighten the load. On that note, let's start. For those of you who've been a part of our session of who've been a part of our series till now, I really want to start with I want to start by thanking you all from the entire team. It's your continued presence, which has been a great motivator for us. It has been a huge inspiration for us, and for basically one of the reasons why we're here today. We've reached where we are today. For those of you who are joining us today for the first time, let's start with a little quick introduction about who we are, how we came into being. So, Healthy Minds World is an online platform was started almost around the same time as the lockdown began. So it's been 6 7 months now, and yes, so it was started by Pallav and Vivek, and one of the main reasons I think that led to this initiation of this project of this initiative was the fact that their conversations around that time in terms of understanding the impact not just of the pandemic but overall the situation on their personal front, on their professional lives, kind of had this realization that doing something, contributing in a way to make things better was the need of the hour, right? And professional mental health help was something which was definitely being talked about, and a lot many people were initiating conversations around those. But for Healthy Minds, I think the idea was more about providing a comprehensive understanding of mental health, because at a time like that, we weren't just physically logged in, right? We were also psychologically logged in. And to think about those who had been facing prior mental health conditions, it would have been really crazy, because I can say for a matter of fact that even those with relatively better mental health, even they were facing various kinds of challenges. The situation wasn't easy. It was something that none of us had earlier faced. So definitely we were we were grappling with the situation, facing unseen, unheard of challenges. And yeah, so as I mentioned that the reason why Healthy Minds came into being was to provide a comprehensive understanding about positive mental well-being, about what exactly does it mean to be mentally healthy, what are the factors that encompass it, how can one be mentally healthy or support someone they know who needs help, right? So all of that, especially from a perspective where you needn't necessarily come from a field of psychology. So we wanted to ensure that we were providing this information in simple, easy to understand language, so that we could definitely further the cause, especially in a country like ours where unfortunately even today there's a lot of stigma, there's a lot of taboo that we have to deal with. So that was our vision. And it's great to see how we've worked on different ways to bring about to further our cause, I would say. So we've definitely grown. The team today consists of a bunch of senior psychologists, counselors, therapists. We have mental health as well as marketing professionals, all led by Khushbu. And we have been conducting with respect to what our main agenda is, we've been passing this information in various formats. So we've been sharing informative content, be it through blogs, be it on our social media, through sessions and seminars such as the one we have today. And we will be sharing the links to whatever we have been working on so far in the chat section. Please feel free to check them out. And yeah, just to give you a brief, insight as to how it's been going. So we've conducted workshops and webinars around various topics ranging from academics to more informative and awareness based. So there have been sessions around psychoanalytic school of thought, there's understanding your subconscious mind, psychotherapy, clinical psychology, as well as forensic forensic psychology, and a lot more. And coming to our session for today, for those of you who aren't aware, it is part of a larger series that we had started a couple of weeks back, which was primarily to to decode various mental health disorders. I mean, in our day to day lives, be it popular fiction, be it conversations with friends, with family, we often come across, these mental health conditions, but we're not really sure how much of these conversations are verified, are these are filtered from a professional's from a professional level. So we talk about depression, we talk about anxiety, we talk about panic attacks, but how many of these conversations are through a verified psychologist? So, through this series, our intention was to understand, to kind of dig deeper, right, when it comes to these mental health conditions. If we look at the news, if we look at whatever is going on around, yes, there are conversations about mental health, but nobody really cares to, uh, to break it down into simpler words, that what exactly it is all about. So, we started off with interpreting depression, then we moved on to understanding anxiety and panic disorders, and to our our last session, which was on OCD, or obsessive compulsive disorder, and phobias. And today we are gonna discuss an equally important, but I would say not uh, as much talked about, mental health disorder, which is bipolar disorder. Right. Now, talking about bipolar, I mean, if I have to talk from a personal experience, I do know that when it comes to me or people around me, we're aware that something of this sort exists, but how much of that information is verified, how much of that is basis well informed conversations, or basis thorough discussion from a professional, is something that I'm not sure. So yeah, ideally our session today, we have a wonderful guest with us who's going to help us understand bipolar disorder from a professional perspective, throw some light about what are its symptoms, what are its causes, and how can one basically deal with it. And before I request her to join us, or before I introduce her, I would quickly want to just introduce, for those of you who aren't aware, bipolar disorder is essentially a mental health condition where a person suffers from, you know, kind of fluctuates between periods of depression to periods of normally elevated mood, right? So that is essentially about that. And we have with us today Devanshi, who is a manager clinical psychologist at Moms Believe. She is an extremely rich 15 years of experience, of which 10 years is academics and 5 years of professional experience. And she also has the license to practice psychology in 3 countries, which are Canada, UK, and India. She is a RCI licensed psychologist and is currently pursuing her PhD in clinical psychology. uh, Devanshi, may I request you to please join us?
Thank you so much, Paridhi, for this introduction. I am not able to switch on my video because it says that the host has disabled it. I don't know if you could please help me in
Sure,
this.
sure. uh, could you try now?
Yeah. I don't know why it's not happening. Just give me a moment.
Sure, sure.
Let me try. Yeah. So are you able to see me?
Yes, yes.
All right, great. So
Perfect.
thank, so thank you so much for this introduction, and I am honored that I've been provided this platform wherein I can make people aware about this particular disorder or a mental health condition, because I come across a lot of people in my practice who are not really aware of what it is. Some of them mistakenly think it as some sort of a only depressive episode or some sort of psychotic illness. So I think in this light we'll be able to enlighten a lot of people and aware them about what exactly it is, what are the phases of it, and when should they refer to a therapist or a psychiatrist. So all these important issues I think we'll be discussing. um, so you can let me know about whatever questions people have. And to start with, as you've already told us a brief about what bipolar disorder is. So I would like to start with introduce it as to what exactly bipolar disorder is. So as the name suggests, in itself, bi means two. So this sort of a mental health condition has two strands or two poles to it. So one is the depressive pole, where the client does not feel very very good about their entire day. They feel very low on energy, they don't want to do anything around them, and they often get negative thoughts which are not in their control. Followed by, there is the on the next pole, on the next side of it, we have something wherein the client might feel very very energetic, and they might have some days wherein they feel that they can do anything and everything that they want to. And they it can be coupled up with the with grandiose ideas. It can be coupled up with a lot of plannings, and so many things that a normal person within their practical limits may not be able to achieve. So that's why this name has been given to this particular mental health condition. Bipolar means that. So there can be a lot of there is something called cycling. Cycling means that there can be cycles or episodes of depression and mania, what we call the one which is an accelerated phase of this is that is called mania, and which is not very accelerated, and the down phase of it is called depression. So sometimes so it depends from people to people. Sometimes there can be a rapid cycling, there can be an ultra rapid cycling. Now what do I mean by these technical terms is, so sometimes there can be episodes of depression and mania in the same day itself. So I might feel extremely depressed in the morning time, but by the time evening approaches, I'm all very geared up, and I suddenly I'm opposite to what I was feeling in the morning. Some people might have phases. So some people might have it for few days, might have it for few weeks, and again these things keep switching in based on days and weeks. So the prime factor in this is that you have to basically see, all of us feel depressed at some point of time. All of us feel energetic at some point of time. It is absolutely normal. We are all humans, But when is it when we call a particular problem a disorder? So when it is dysfunctioning your order of working, So for example, if I'm feeling sad, I've had a bad day, but still if I'm able to perform well on my duties or on my office or whatever has been assigned to me, I'm still moreover able to give in my best. Then I would not call it a disorder. It can be a phase, or it can be a light state of not feeling good or sadness or whatever. But when slowly and gradually my day to day activities become dysfunctional, when I'm not able to get up on time, I'm not able to do anything at all, I have all the happiness in the world, but I still feel that there is something wrong, I'm not feeling good about it. So when it is kind of making me dysfunctional in my day to day routine, so that's what we call a disorder. So and in bipolar disorder, so depression is something which is very very commonly seen and recognized by people. But sadly, the mania part of it is not recognized that often, because a lot of people think that, oh, it's just a very it's a day wherein I'm full of energy and I can do a lot of things. So it has been seen, clinically also. It's the people around, those particular clients who are able to see that, there is some sort of a elevated mood which is not really, required at all points, but still the person is so enthusiastic all the time. So it's the family members, it's the friends who are able to see that there is a drastic change. Depression, on the other hand, is something which sometimes people are able to, make you make they are aware of it themselves also. There's another reason why people are more aware of depression as compared to mania, is because it's a more talked upon topic. There is more awareness regarding just the depression part. But as Paridhi had said in the beginning, that a lot of people are not aware of why what bipolar disorder is.
Right.
So that's why it is important for you to know, when to consult a psychiatrist or your psychologist, or when to talk to your therapist. So this disorder basically has phases, what we call the prodrome phase. So what do you mean by prodrome? Is, again, this is a technical term. So basically prodrome phase is when a person feels that there is slight elevation in the mood, or there is slight depreciation in my mood, but they are moreover able to do things, but they don't feel that normal or that good about themselves as they were feeling when they were absolutely doing okay. So this is a phase, wherein all the family members, or all people around them, or even the client themselves, they should be aware, now this is the correct time wherein I should be going to a psychiatrist or my therapist and talk about it. Because at that time, in that prodrome phase itself, if we are able to gauge the symptoms and provide correct treatment to the client, he or she might not land into that exaggerated state of problems, or that exaggerated state of disorders. So at times bipolar disorders, if left untreated, also require hospitalization and treatments. So it's important that you recognize these things in your day to day routine. And see, one important thing that I always say to everyone who's here, or all around the world, that please don't take these these words, bipolar, depression, anxiety, these as stigmas or as labeling. We are not trying to label you. Okay, so if you come to me as a psychologist or a psychiatrist and you ask me what are you treating me for, so I have to have an answer for it. So this is a diagnosis, just like how we diagnose cancer, thyroid, diabetes, any sort of physical illness. So we have named it, right? If we call a person diabetic, they don't feel bad about that because it's a part of the lifestyle disorders now. But if we call somebody, oh, you're depressed or you're bipolar, people get very, very offended. So I think in general, it's not just for the clients because they're already going through a lot. It's for the society in general. They need to understand these are not labels. These are absolutely normal diagnoses like we make in physical illnesses. So please don't stigmatize people who are suffering from it, and please support them. Because anybody can fall into any sort of trap or psychological stress or anything like that in their lives. And another important thing that I noticed during the COVID-19 timings, I mean, because this was a very unusual pandemic time, which we have not viewed. Of course, there have been pandemics in the past also, but our generation in particular has not seen something like this before.
Yes.
So uh, so uh, in these times I came across a lot of people, who had increased their who had like increased sense of either motivation of doing things, work from home, because it was a change thing. On the other hand, there were people who were not very happy about it, and a large chunk of people who were fearful of this issue, who had developed sort of anxiety, depressive symptoms, and so many other things at the background, because it's something new. So I think it is important that all of us build some basic psychological skills and coping mechanisms as well to deal with these day to day things, because life does not remain the same every day, it's dynamic.
Definitely. That's a valid thing. I think it's a comprehensive and a great introduction, Devanshi. Thank you so much for that. And the main takeaway before we, back to bipolar remains that when it comes to the situation that we're going through right now or overall mental health conditions, eradicating the stigma is critical, not just for the person who's undergoing it, but also for people around them to ensure they're able to deal with it in the best possible manner. On that note, I think as you were talking about bipolar, right? So, talking about the complexities, my first question to you would be to understand that how does a person with bipolar disorder think like, and yeah, as in, are there any common symptoms that people around them or they can look out for?
Okay. So see, there is no differentiation of thought processes in general. Like, of course, suppose if my thought process regarding my particular day, like I'm trying to plan my day around my office schedule or around my home schedule, I'll have like normal thoughts. But what happens in bipolar disorder is sometimes these thoughts get aggravated, or they reach those dimensions which are practically not achievable. So for example, just an example, suppose I'm trying to lose weight. So okay, so I would have a very normalized thought of managing a diet plan and doing exercise in a balanced way, which I know my body can allow me. But if, let's suppose, I have this mental health condition, I might not be practically able to understand how much should I be dieting, how much should I be working out. So my thoughts, my normal thoughts, get so exaggerated, so accelerated in my mind, that I don't realize how I'm dealing with my situations, and how it is affecting my body or people around me in an abnormal way. So and some, so see, in bipolar also, especially in the manic phase, there are a lot of phases, there are a lot of symptoms. So some people tend to show very grandiose ideas also, which also means which is also called in technical terms accompanied with delusion of grandiosity. So a person might feel that I can do 10 or 15-kilometer running every day. I can break the record. I can do this, I can do that. So there can be so many things which are practically not achievable. It's just the exaggeration of your normal thought processes which become a problem. And even when people try to stop you, or people are trying to tell you, this is not correct, I might just take it a little offensively, or I might be very highly sensitive to what people are trying to say to me, which I probably would not be if I am not undergoing any sort of elevations like that. So it's see, if a person has bipolar disorder, it does not mean he remains like that throughout his life. No, there are phases when you will do absolutely fine, you will be normal, there'll be everything would go good in your life. And then there are phases which are accompanied with these two strands of depression and mania. So that's why I said it is important for everyone to be mindful. There is something called mindfulness. Mindfulness is a very simple concept. It means to live in the mini present and to be self aware. That's all. So we all know what mindfulness is, but it's just that none of us know how to execute it. So just a small exercise of execution is, maybe you can always write down, how did your day go by, and what did you do in the whole day, today, how much did you eat, how much. So you are being aware of every little thing. It might sound a little chaotic to you, or it might sound, oh my god, do I even have to write down how much am I eating now. So it's not about writing down just for the sake of it. It's understanding your own self. When you're able to understand your own self, you'll be able to mark changes in your moods as well. You'll be able to see that, okay, all this while, let's say in the month of August, I was doing fairly well. Suddenly a stressful situation came in, or even if not stressful, there have been a lot of studies, and it has been seen that a lot of people develop sense phases of mania during times of wedding or functions, or something which is not a bad stress, which is because a function or a wedding, and all these things are supposed to be positive in nature. We that's a time when we are developing eustress. Eustress means when we are dealing with it positively. Like, it's not a bad stress. Bad stress would be when I'm trying to achieve something, in terms of, let's say, I'm struggling with some sort of an illness, and I'm trying to recover from that. I've had a bad experience, I'm trying to recover from it. So when I take stress, how to recover from that, that is called distress. So basically every time, so it's not that only stressful situations can induce mania. Yes, these kind of situations, can also induce mania. So if you're more aware of your own thought processes, if you're more aware of your own self, you'll be able to mark that, okay, there is something, which is not correct right now. Maybe I should talk to my therapist and take a quick check. So now, most important is why you should talk to a therapist rather than only a friend or your family members, is because your family members or your friends will have their own subjective views about what you are going through. A lot of them might not even recognize this as a mental health condition at all. They might just say, oh, you are overthinking, oh, you are like this, oh, you're like that. So it might perplex you even further, that okay, what I'm going through, is it even normal or no? But my friend said that I'm overreacting. So it kind of leaves you in the self doubt again. If you are in self doubt, if you are low on your self esteem, again, you get very, very baffled. So going to a therapist is always important, so that your therapist can objectively see that on 10th of October, these were your symptoms and that's how you were feeling. Now, today on 15th of October, what has happened that suddenly, all your feelings are accelerated, whether it is in terms of depression or mania? So, he or she would be, your therapist would be able to tell you objectively. That's why it is important for you to speak to a mental health professional, and not to friends and family. They are not wrong, but they would have their subjective glares on when they are seeing you. So so that's about it, I think, that I would like to add in here.
Precisely. Moving on, talking about bipolar, we've had some questions on this front as well. So my first question is: are there any particular triggers for bipolar? And second is there an average age at which a person is more prone to face bipolar disorder?
Yeah. So as I told you about the triggers, so triggers can be any stressful situations, or even situations like where there is a function or a wedding or a party, or you're attending an event. So anything can trigger it. Now you have to, and another thing is, before us, going on to the triggers, who are those people who are more prone to develop it? That is also another important part. So it has been seen that there is a genetic basis also. If somebody in your family, whether it is your immediate parents or your first degree relatives, any of them have this problem, it is likely that you might also develop the same. But if you are able to, again, I said, like, if you are more mindful, if you are meditating, if you are being mindful about your own self, carefully churning out those prodrome phases, you might not land into that exaggerated disordered scale. So triggers can be anything, any sort of stress. And what is a trigger, it also depends from individual to individual. So I might find COVID-19 aspect as a major trigger in my life, and at the same time the other person might not find it as a major trigger and might enjoy it, because I'm home, I'm working from home, I have my flexibility. So there are two aspects of seeing every trigger. But yes, these are some of the common things. And for the age, it's been said that between 15 to 30 is the time when most of the people are able to recognize that, especially regarding this disorder. Why am I saying 15? Is because before 15 you are still a child and you're trying to develop, of course, although it's precisely 18, but even before 15, you are in the developmental phase. And a lot of people might confuse these symptoms with other disorders like ADHD, or with any sort of learning difficulty deficits or anything like that. So I think after 15 is something that you can this is the average age, where a lot of people report about this disorder.
Uh, okay. And as you mentioned, right, talking about how to diagnose or how to, go about it. And as you mentioned that rather than, solely depending on friends and family, one should prioritize seeking a professional's help. So, talking about the diagnosis for bipolar, what are the ways in which it can be diagnosed? And do you think a combination of medication as well as therapy is more effective when it comes to treating bipolar?
Okay. So, yes, there is a formal way of, diagnosing and, treating bipolar disorder. So it's very important that when you walk into a psychiatric setup or a psychological setup, the first and foremost diagnosing, testing tools are that you do a basic case history and a mental status examination for the patient, followed by then, you have your rating scales and so many things, and not just, be based on objective rating scales, because I have to, as a mental health professional, I have to, talk to the client, talk to his family members around. So apart from what just the client is also feeling, what their immediate family members also feel regarding that particular person, because they've known him the best, taking that also into consideration is very, very important. Now, in there is something that I did not mention. There is a milder version also of bipolar, that which is also called like dysthymia or cyclothymia. These are again technical words. So dysthymia means wherein you're only and only depressed, but to a very little level, wherein you are depressed throughout the year, but you're still able to manage your work. You're not feeling distress about managing your work. And there is another thing called cyclothymia, which is again a very milder version of bipolar disorder, wherein again you have your phases of feeling sad and feeling happy, but you're still able to manage things. But when this goes beyond control, so yes, these there are some of these ways of diagnosing it. So first it has to be correctly diagnosed, and then based on the intensity of the diagnosis. So I might again, if I'm undergoing dysthymia or cyclothymia, I might recover from extensive therapy. I might, but again it depends on the how the client is reacting to the therapeutic process. But if the intensity of the disorder is to a level wherein no therapy can work, nothing can work in this, so then medications are required. In fact, medications are very important, because sometimes, just doing therapies or counseling might not be suffice at all. So if you're not in the correct frame of mind, if you're not basically in your most calm stage, wherein you can listen to the therapist, wherein you can follow all the things that are being said to you, then the entire therapy becomes meaningless. So it is very important, especially in the case of bipolar disorder, that you take your pharmacotherapy and psychotherapy hand in hand. And pharmacotherapy is very important if the intensity is high.
Okay. That's, I think, extremely important and good to know. Moving on about some of the other disorders that can coincide or can complicate with bipolar disorder. So my first question is, do you think, this is from one of the participants, and it is and goes that, can inferiority complex leading to overthinking be a cause for bipolar due to accelerated repetitive thoughts?
Okay, so there are like too many connections in this. So see, having a low self-esteem can lead you to have certain depressive thoughts. It can be one of the reasons for you to fall into any psychological states. But um, I cannot say that it will lead to bipolar. So because a lot of, again, like I said, every individual is different, every person is different, and it's different for each individual. So sometimes if you have a genetic predisposition to this issue, then I think you, yes, might end up having this. But let's say if you do not have any genetic predisposition and you're still able to manage, so again, as I told you, whether it is overthinking, whether it is low self esteem, whether it is stresses, anything can induce it, but you have to understand the intensity of it. If it is in your, no, if it's in your limits of managing it well, well and good. If it is not in your limits of managing it well, then it is it is something that requires professional help.
Okay, right. And moving on, I think another another mental health connection that question that we have is, do you think conditions like ADHD or dissociative disorder can play a role in developing bipolar disorder? And is it possible for a person to have both dissociative disorder as well as bipolar disorder?
Okay. So basically, see, ADHD, dissociative disorder, and bipolar, these are all independent diagnoses. So these cannot, they can comorbidly. Now, comorbidly means, suppose I have been diagnosed with bipolar, it can coexist with my current situation, but it's not possible that a person has bipolar also, dissociation also, ADHD also. So all three together is something which is rarely seen. We have to basically prioritize which is the first primary diagnosis. So if a person has, let's say, extreme mood fluctuations, extreme mood swings, little bit of ADHD component, or at times dissociation is there, but we have to prioritize what is more evident in the person. um, Dissociation can be a part of it, maybe a slight part of it, but it cannot exist with bipolar disorder. It's a completely different diagnosis. But ADHD is something that is commonly seen. So a lot of people do, come to me that, we've been treated for bipolar, we are doing extremely well now, but still we are not able to meet the deadlines. We are still not able to, attend to our work properly. And we know we kind of go in our daydreaming and stuff like that. So yes, ADHD is something which is more commonly seen as a comorbidity with bipolar disorder. And you should be able to basically, again, if you're, let's say, seeking treatment for bipolar disorder, and you feel, despite of feeling good about yourself, you're still not able to attend properly to a lot of assignments or a lot of work, then I think, then it's important that you bring it to the notice of your treatment personnel, and seek treatment for ADHD as well. So there can be, so the medical part of it is decided by the psychiatrist whether they can give both the medicines together or no. I'm not the correct candidate for that, but there can definitely be some attention enhancement exercises that can be practiced hand in hand, with bipolar medications or anything. So those techniques will never harm you. So that's about this particular question.
Right. And I think at this moment, I would like to take a question from one of the participants since we're talking about, comorbids. Can bipolar disorder be comorbid with narcissistic personality disorder as well?
So narcissistic personality disorder, we don't call it a personality disorder, it's a narcissistic personality trait. So it means, so some people who are not aware, narcissistic means when we are extremely, self-obsessed, so it goes back to the historical times. There was a king called Narcissus who was in love with his own self. And he looked at a pond and he like fell in it because he wanted to, be with his own self. So basically, narcissistic personality trait is people who are very, very self-obsessed. It it can exist as a trait, maybe, let's say if you have that trait of narcissism in you, and you eventually develop this disorder, again, that trait can get exaggerated, so that, for example, if I'm in mania, I might just be talking about my own self the whole day. I'm not bothered about anybody. I'm only talking about how I will, how am I looking, how I should dress up. Whole day I'm just spending on my own self. It can be accelerated, but it's not something that can lead to bipolar. So again, I said it can comorbidly be there.
Okay.
So yeah.
Got it. Okay, I think then let's move on to the next question, which is about the treatment aspect. Under ideal scenarios, uh, what would you think? Like, how long does the treatment of bipolar continue? And again, I mean, this is something that we briefly touched upon, but how do you think can family and friends, what role do you think can they play when it comes to the treatment for bipolar?
Yeah, so basically, see, the treatment history, it depends, like, the duration, sorry, the treatment duration depends on, again, what is the intensity of the problem, how well is the client responding to the psychotherapy and pharmacotherapy. So I might have a client who just starts giving me responses do both the therapies within 1 week's time, the client starts feeling better. But there can be somebody who might not show a substantial response even after a month of medications. So it depends, really it depends from person to person. So it's just like any other physical illness, it depends on your physical immunity. Similarly, depends on your mental boosting immunity, how well you're able to come out of it. And in mental health issues, family and friends play even more critical and even more essential role as compared to physical illnesses. Because physical illnesses, people still take care of the person who's suffering from it. They understand, oh, this person is not well, we should not let him do the work, or we should take care of him, we should be empathetic. But in mental illness, sadly, this never happens, because you physically can, tangibly, you cannot see a person suffering from anything. It's just a thought process, it is an intangible thing which cannot be seen by anyone, so people assume that this is not a problem at all. So for family members, before the client, I think the family should be psychoeducated first. It's important for family members to first understand, not just family members, even close friends, to understand what their family person is going through, and how they should treat him, how they should not exaggerate or mind what the person is saying. So definitely, I think in mental illnesses especially, family plays a crucial role, and they should be psychoeducated before even treating the person. Once you've made your diagnosis, it's important that you sensitize the family about it first. So
Right.
that's
Definitely. I would, Devansh, at this point, want to return to one of the previous conversations we were having about genetics, right? What role does genetics play? There was this question about genetic testing, which was about, do you think we are at a point where a gene test can be done for bipolar and, the mental health disorders?
So there are genetic counselors who are there, before you plan your pregnancy. But I don't know, like uh, in India, because this is something, a mental health, era in itself is very new in India. So a lot of people do undergo for a genetic counseling if there are physical disabilities in either of the parents. But even for mental, illnesses, yes, you can undergo a genetic counseling. But again, the person might not be able to give you a very accurate idea as to whether the person would believe. So again, there are chances, if either of the parents have it, 50% chances are there. So the percentage depends on who immediately has it. Is it your parents, I mean, is it the immediate parent, or is it the first degree relatives, or it's the far off relatives? So the three generational down the lane, it's basically in the family genogram, or the family tree, what we call more commonly, it is seen that genetic counseling can be sought.
Right.
But again, I said there is no accuracy for anything. So I think developing psychological skills, mental hygiene practices and techniques is something that you can always do.
Definitely. That sounds interesting. Another aspect that we've been discussing, right, and as you'd mentioned that about a certain age when bipolar condition sets. So this question is with respect to sort of fading away. Is there possibility that bipolar can eventually get better at certain age, say somewhere around 50, given that the energy levels decline and can cause lower manic tendencies?
So yes, when you have bipolar disorder, and the mania might fade away, but then it might increase the depressive part of it, because you are not very physically accelerated during those ages. So some sort of a depressive mode, and not being able to do things, like having negative thoughts, and all these things might increase by default also with age. So you might have seen, even if people who do not have this particular condition, once they're nearing their 60s 70s, there are a lot of locomotor difficulties or physical difficulties in itself which kind of bind them to be at one place. And a lot of them do experience depressive thoughts. So people who are in higher age group, they need to be more careful about the depressive phase of it. So that should not accelerate. If the mania is going down, please make sure that the depression part of it does not accelerate. And the ways to curb it is, again, you can practice certain psychological techniques to get away from it, and try and keep your exercise and your physical regime upright, so that some sort of energy is being boosted in your body, and you feel well that way. So, and people in the younger age groups should be more careful of the manic symptoms being more evident.
Right, right, definitely. Okay, now coming back to our conversation about bipolar, uh, talking about professional environment, are there certain ways in which bipolar patients behave in professional setups, and what kind of an impact do you think it can have for them in the longer run?
Hmm. So basically, see, there can be, again, as I said, due to elevations in moods, there can be abrupt and abnormal behaviors at times. But again, if I think, like I said, that it is important to psychoeducate the family members. And I know this is kind of difficult, especially in India right now, to sensitize even the employers or people around them that this person has a condition. And if you come across something like this, please try to ignore that part, and maybe you can refer them back to the family members or to their concerned doctor. Abroad, yes, a lot of people are following that, but here I think, again, there can be ways of behaving in a certain unusual ways. So again, you need to, I think, if we can't rely on the entire system, but at least one of your colleagues at office who can be sensitized to your these behaviors. And once you are in that phase, that person can at least help you to calm you down, and let your boss or your immediate management know about it, and maybe get you off on leave or something like that. Or maybe at least if not that, then at least that person can let you know, for you to have a reality check, that how am I behaving, am I okay, so that at that point of time you can refer to your therapist.
Right.
So definitely there can be ups and downs. Having this sort of a condition, you can have these ups and downs at work or at home, which is normal.
Right. I think on that note, we're just gonna quickly check what other questions we have from the participants. Hmm, second. I think most queries have been around, understanding comorbids, and especially the genetic angle is something that's deeply interested them, right? Whether it's passing on from immediate family or uh, others. I think, yeah. So I have one question, which is about uh, when we were talking about excess episodes of depression or excessive depression, would you say that suicidal tendencies and thoughts are also a part of bipolar, and in what capacity does bipolarity trigger these thoughts due to excessive depression?
Okay, so this is a very interesting question. Basically, see, suicidal thoughts can exist in either of these phases. The biggest challenge, and one should be really, really careful of, is that if this kind of ideation comes when a person is in mania, that time you need to, the family members, or if the person is admitted in a hospital, the healthcare workers or somebody at their work, let's say they are not admitted, they are at home on medications, they need to be very, very careful, because the sudden impulsivity to do something is much more in mania. Although it can again vary from person to person. But as compared to depressive phase, yes, if in mania this kind of ideation takes place, then the family members should keep an immediate check. There should be immediate crisis intervention, meaning that no like the therapist should intervene, the psychiatrist should intervene to at least calm the person down. And if the person does report these suicidal ideations, obviously he would first report the ideations, he would not just suddenly do something. But even if the slightest ideation is reported during mania phase to a family member or to a friend, they should bring it to the notice of the mental health professional. And no sort of sharp objects or any things that can harm a person should be around them at all, because that impulsivity, when that thought happens and that impulsivity is there, the person might not be able to think about anything and just go ahead and do that act. On contrary, in depressive thoughts also, yes, these thoughts can be very very active, but but the locomotor, again locomotor meaning the physical aspect, you might be very physically drained out to perform on certain acts. So it might slower down the process of the act of doing it, but then again that does not mean that we have to just let it go. We have to again very carefully deal with these ideations and try to get the person out of these. So it can exist, although it doesn't exist for everybody, but yes, to some, with some people this can be there.
Right. I have another question. I think we were also talking about this in the introduction about. Uh, so the question is, do you think? Okay, yeah. The question is that body shaming and obesity struggles of more than 2 years can cause depressive episodes, with along with repetitive thoughts of self judgment. In such situations, do you think can only counseling and therapy be enough? Is it sufficient, or medications should also be a part? Should also be included as treatment?
So again, like I said, although this is not connected to the topic, but like I said, that if your thoughts, repetitive thoughts, that then that is another condition, obsessive compulsive, like obsessive thoughts. If those are very prominent in your mind and it's not letting you do anything, it's leading you to have abnormal behaviors around you. For example, if somebody has body shamed you for being fat, and you're not eating, you're not even taking your basic calorific value in the whole day, and you're starving yourself, you're just working out and doing nothing apart from that, then that requires definitely that requires medication. So again, like I said, if it is hampering your day to day functioning, if it is not letting you function normally at all, yes, you must sought medical treatment for this, like psychiatric treatment. But let's say if you're still able to manage things, then therapy alone would be helpful. But see, in any sort of a mental health condition, uh, medicines play a good role, like to about, you can say, like 60 to 70%, yes, but the remaining part is the therapeutic process. So I am taking medicines, I am feeling fine, but what do I do to maintain that feeling fine, wala, that particular thing. So to maintain yourself, to learn the strategies, no matter what, psychotherapy is very very important, in congruence to all this.
Definitely. As we're inching towards the closing time, just I think couple of questions that we're gonna take. Uh, what do you think is the difference between bipolar disorder and borderline personality disorder?
Okay. So, these are very similar to each other. There's a thin line, but see, in borderline personality disorder, the person would not have extreme elevations of mood and affect. Affect is something which is a prolonged, version of mood itself. The borderline personality trait will be accompanied with a lot of manipulations and trying to just, if for example they want to get their work done, they are logically able to sequence out things, very logically able to come out of a certain situation. But in bipolar, the logic is also at times hampered. Like for example, I'm not in touch with my reality, especially when I'm in a phase of mania. So I might have very very irrational beliefs which on contrary are not present in borderline personality disorder. So in borderline personality disorder, the person tries to logically and manipulatively try to come out of a certain situation, and that's moreover like a personality trait which is there since the beginning. It is not something that all of a sudden you become borderline. No, these are some of the traits which can exist since your childhood, and that's how you are. And that's how probably people around you need to adapt accordingly, because that's your personality type. But disorder on the other hand is something that is developed over time. People can develop, people with any personality trait, is not just borderline, narcissistic, antisocial, any of them can develop this bipolar disorder. But it's not essential that if they develop bipolar disorder they will develop these personality issues also. No.
Right. Got
So
it.
yeah.
That's, I think, interesting to know. Talking about something that we just started off with about the symptoms, right? Do you think bipolar patients uh, exhibit psychotic symptoms as well?
So, yes, there can be a lot of. So that's why, as I told you, when we make our diagnosis, I did not mention there are two classificatory systems called ICD and DSM. So, ICD is International Classificatory, system that is being followed by a lot of clinicians all over the world, and DSM is the Diagnostic Statistical Manual, made by American Psychological Association. So basically, they both the classificatory systems, they look into how to diagnose these disorders. So yes, there is an aspect in that people who have this disorder can develop psychotic symptoms alongside, and it's called BPAD with psychotic symptoms, bipolar affective disorder with psychotic symptoms. Now, how do we differentiate? This is very important again. How do we differentiate between a simple mania and a psychotic symptom? So a person who is in mania can mimic, people might mistakenly think that he's having a psychotic episode. So in psychotic symptoms there will be hallucinations or delusions. What is hallucinations? Hallucination is something that I see, I hear, I feel, or I smell which doesn't exist. So I might hallucinate visually. I might hallucinate auditorily. So I might hallucinate in terms of olfaction. So when hallucinations and delusion on the other hand is any false irrational belief which cannot be changed even after testifying an objective evidence. Just a simple example, like for example, I have this delusion that suppose Paridhi doesn't like me, she wants to harm me. So I might have this delusion that every time I see you, I get this thing that you are here, you, even if you're carrying a pen, I might think that you're carrying that pen just to come around me and hit me with it. So that is again a false irrational delusion in my mind. Even after testifying, even after you or anybody explaining me that it is not like that, she was just carrying a pen for her own use. That's when you need to see that where is the are these aspects present, hallucinatory aspects, delusional aspects, total disengagement with the reality along with manic symptoms. Then yes, you can say that bipolar can very well exist with the psychotic symptoms, and similarly not just in manic phase, even in depressive phase.
Right.
Yeah.
Okay. I think on that note, since we're also, almost running out of time, I think, can you help, close this session by throwing some light on, what basically is the procedure? Because I've had a lot of questions about people asking of a misdiagnosis, especially for bipolar. So
Hmm.
when it comes to choosing the right therapist or ensuring that we're in good hands,
Hmm.
what would your inputs be there?
So, see, it is very important. Especially in the mental health domain, because now that there has been an increased awareness about mental health, everybody just sits and talks about mental health. So, you have to carefully churn out and see whether you're in India or any country. So abroad, it's a very, very, closely monitored profession. But in India, because it's in its booming stage, a lot of people aren't aware. So you have to basically see your therapist, your psychologist should be licensed with Rehabilitation Council of India. Anybody who does not hold an RCI license is giving you a diagnosis is not legitimate enough to give that. They are not legally allowed to give you any diagnosis. Apart from the psychologist, you should be in touch with the psychiatrist also. These two people are your main point of contact, or main point of contact for the family members, so that you can be correctly diagnosed and you can be correctly treated. uh, if you go to any counselors or people who do not hold RCI licensing, who've not done their MPhil clinical psychology in India, then you are risking yourself. Because as I told you, bipolar disorder, borderline personality traits, ADHD, dissociation, psychotic symptoms, they look just similar. So somebody who is not trained to differentiate between these thin lines, how can that person give you a diagnosis, right? So, and again, as I told you, I would like to conclude on this particular note again, which I have repeated earlier also. Please do not take these diagnoses as labels on yourself. These are not to stigmatize you, these are for your own treatment, for your own benefit. Try to view them in a positive light. Try to understand that, okay, I am happy that I got to know that this problem is there, so I'll be more careful now. I'll be more mindful, and I'll be more effective in my way with it now. What if you never got to know? What if you were just in a soup altogether, and whole your life you just heard people say tum aise ho, tum waise ho, tumhe ye nahi aata, tumhe wo nahi aata, despite of you having the caliber to attain everything in this world. So don't let these problems limit your ways of functioning. So it is important. That's why talk to a mental health professional and carefully choose your mental health therapist and your psychiatrist. Always look at their qualifications, their licensing. If they are licensed, go ahead. If they are not licensed, um, uh, in fact, you should ask them that how are you able to give me diagnosis, because there is a lot of malpractice which is happening in India at present. Okay, and not just diagnosis, even your therapy sessions should ideally be taken by a licensed professional. So you should be careful of all that. As I said, on this note, I would like to conclude that please don't let any condition, any mental health condition, limit you in any ways. You can attain your best. This is just like a catalyst. It will just act as an added support, and don't refrain yourself from any treatment, because and please do complete your pharmacological and psychological treatment. Do complete that entire course of treatment, so that you can come out of it effectively. Is just exactly like any antibiotic or any physical illness treatment. If you don't complete those 5 days, you again, you have chances of relapse. So be careful so that you do not relapse into it. Bipolar affective disorder is something that can have its relapses. I told you how to take care of those relapses. Is try to see that prodrome phase, try to recognize. So your therapist, your psychiatrist will give you a checklist that these are the problems. If you feel maybe after 1 month of getting treated completely fine, you feel these things are again coming back, contact us so that we can help you come out of this. So yeah, that's on that note, I would like to conclude it this way. And I hope a very happy and a positive mental health to you, because then only we'll have a positive physical health.
Definitely. Thank you so much, Devanshi. That was a great closing note. And on that note, I would also quickly want to just mention for those of you who not been able to get your answers, we have, in fact, crossed our time. So please do reach out to us. We will get in touch with Devanshi and ensure that we're able to, provide answers, especially given we are all aiming for better mental health, for better overall functioning, overall smooth functioning. So please feel free. I think we've shared the details in the chat sections. Whatever queries you have, do share with us. But we've had a great session understanding bipolar disorder. Devanshi has been extremely generous in sharing such wonderful insights when it comes to bipolar disorder and manic depression. So thank you so much for being a part of our session today. Just to end, we will be hosting a session on suicidal thoughts and behaviors next Sunday, same time. So if there is something, let's hope we will learn new things. Please do join us. And on that note, I think, Devanshi, I would like to thank you from the entire team's side. Thank you for taking time out on a Sunday and enlightening us.
Thank you so much for giving me this opportunity. And like Paridhi had said, if you've got any questions, I'll definitely get back to you in writing about those questions. You can forward those to me, which have not been answered today. And I'm happy that I was a part of this talk show, this webinar, and I hope to do some more of it with you ahead to enlighten people around. I think awareness is the biggest precautionary method that we can adapt at this point of time. So why fall into it if you can take the correct precautions at the right time?
Yes.
So I so thank you so much. So I would like to log off now then. All right.
Perfect. Thank you, Devanshi. Thank you, all the participants. Have a great Sunday.
A clear distinction is often made between the mind and body based on the premise that they both are fundamentally different in nature. But when considering the mental health and physical health, don't you think that they both are interconnected? Mental health is a sensitive topic as there exists a lot of stigma and discrimination around it. Mental illness is assumed to be like an unwanted thought for some time, which will go away on its own. Emotional pain is not as visible as the physical pain. A cut on a finger will receive more attention than the sudden prolonged silence of a person. But do you know that poor mental health leads to an increased risk of developing physical health problems? And similarly, poor physical health can negatively impact a person's mental health, leading to an increased risk of poor health conditions. Stigma and discrimination can also worsen someone's mental health problems and delay or hinder reaching for help and treatment. According to WHO, 1 in 20 Indians suffer from depression. It has also been found that depression is associated with an increased risk of coronary heart disease. Healthy Minds World brings to you a Sunday webinar series, a series of 5 weeks on decoding mental health disorders to eradicate the stigma and myths on various mental health disorders like depression, suicide, anxiety, bipolar, and many more. Every Sunday at 11 a.m. IST, we will understand one mental health disorder from some of the leading psychologists in country.